Good evening, doctors. Welcome again. Today we are going to discuss about Addison disease. Addison disease, also known as primary adrenal insufficiency or hypocortisolism, long-term endocrine disorder in which adrenal glands do not produce enough steroid hormones. So, Addison disease is it. Hope it's clear. Now, see, this is pituitary gland, this is adrenal gland, this is due to adrenal insufficiency, it's suprarenal gland also we can say above kidney, this is bladder. So, it is due to deficiency of adrenal gland hormones. Now, what are the signs and symptoms? Signs and symptoms include fatigue, lightheadedness, muscle weakness, fever, weight loss, anxiety, nausea, vomit, and diarrhea, headache, joint and muscle pain, craving salt, hyperpigmentation, palmar crease, and physical exam we see low blood pressure with or without orthostatic hypotension. When patient stand up, the blood pressure fall down. Hyperpigmentation means melanocyte stimulating hormone increases. That's why hyperpigmentation associated with type 1 diabetes, mellitus, celiac disease, and Hashimoto's thyroiditis or vitiligo. We see vitiligo here. Now, in Addison disease, we can see skin hyperpigmentation, low blood pressure, weakness and weight loss, gastrointestinal like nausea, diarrhea, vomit, constipation, and abdominal. Skin vitiligo we see. Adrenal glands not produce sufficient steroid hormones. Adrenal crisis is a very life-threatening condition. See fever, syncope, convulsions, hypoglycemia, hyponatremia, severe vomit, and diarrhea. It's life-threatening. Now, Addisonian crisis, severe adrenal insufficiency, previously undiagnosed Addison disease, adrenal hemorrhage. It is mainly due to undiagnosed adrenal Addisonian crisis or adrenal hemorrhage due to infection or by trauma. It is a life-threatening condition, require immediate emergency treatment. Symptoms includes vomit, diarrhea, resultant dehydration, low BP, syncope, hypoglycemia, psychosis, and severe lethargy, low sodium, high potassium, and high calcium, convulsions, and fever in Addisonian crisis. We see. Now, let's understand the physiology. What happens? Hypothalamus release corticotrophin releasing hormone, then anterior pituitary release adrenocorticotropic releasing hormone, then adrenal cortex release glucocorticoids, and these glucocorticoids give negative feedback to pituitary gland and to the hypothalamus. The most common cause of Addison's disease is autoimmune worldwide, but in India is tuberculosis, miliary TB, we can say miliary TB. Now, what are the other causes of this disease? Adrenal destruction, most common type in industrialized world, affects hormonal and cell mediated response. Immune reaction against enzyme 21 hydroxylase, a cytochrome P450 enzyme. Non-functioning 21 hydroxylase catalyzes the addiction of an alcohol on carbon 21 in steroids. Addison disease has an enormous amount of autoantibodies attack this enzyme and slowly kill off the adrenal cortex. 82.5% of autoantibodies are adrenal autoantibodies. So hope it's clear. What is it? It's vitiligo in Addison's disease. Vitiligo. Okay. This is acanthosis nigricans, hyperpigmentation. This is hyperpigmentation, or we can say palmar creases. Now, hyperpigmentation visible, hyperpigmentation on gums also. See on his skin hyperpigmentation, here hyperpigmentation on hands, and this is vitiligo hands seen in Addison's disease. Now, how to diagnose? Diagnosed by hypoglycemia, blood sugar level, hyponatremia, electrolytes, hyperkalemia, metabolic acidosis. Why there is hyponatremia and hyperkalemia? Because due to aldosterone work is to absorb sodium, but aldosterone here less production, so it can't absorb sodium. So hyponatremia and it eliminates the potassium, but it cannot able to eliminate, so hyperkalemia and metabolic acidosis occur. How to diagnose? Diagnosis by concentropin stimulation test. Give ACTH analog when there the cortisol level, the normal level is 18 milligram per deciliter. When it is more than 18 milligram per deciliter, that means it's secondary adrenal insufficiency like Sheehan syndrome, postpartum pituitary hemorrhage, or pituitary apoplexy, or non-functioning pituitary adenoma. Diagnosis by CT MRI of head and replacement of cortisol or prednisolone. Okay. When there is a cortisol level is less than 18 means adrenal insufficiency primary, it's Addison disease. Replace cortisol, prednisolone, or by fludrocortisone, or education is important here, mineralocorticoids. We can give fludrocortisone for replacement of mineralocorticoids. This is a picture of Addison's disease. See, vitiligo's, here vitiligo, here vitiligo. Okay, hypopigmentation. Let's discuss this picture. Symptoms of Addison disease: fatigue, lassitude, malaise, weakness, anorexia. Postural dizziness, syncope, nausea, vomit, diarrhea, abdominal pain, diarrhea, constipation, myalgia, arthralgia, reflex, rarely flexion, contracture, decreased libido, and amenorrhea in female. And signs: weight loss. Why weight loss? Because cortisol level decreases. That's why weight loss. Hyperpigmentation, MSH, melanocyte stimulating hormone increases. Hypotension, we see thinning of axillary and pubic hair and vitiligo. Okay. So guys, I already finished with this Addison's disease, and the patient who is suffering from Addison disease, he can wear even one tag on hand that this patient is suffering from Addison's disease. He has even cortisol injection also when he is going in Addison's crisis. Then he can self inject hydrocortisone, or maybe someone, those who find him in Addisonian crisis. So guys, have a good day. Goodbye. That's all for today. And if you have any queries, any question regarding this Addison's disease, you can ask me. And if you still not subscribe my channel, please subscribe it. Thank you. Good day and goodbye.